In this session, we're going to break down exactly why every student in medicine, nursing, electromedics, informatics, and radiology needs to master this system. Because in healthcare, everything is connected by circulation. Here is a brief explanation of why students across different medical disciplines need to learn the circulatory system. While the depth of knowledge varies by profession, understanding how blood moves through the body is fundamental to all healthcare roles. 1. Medicine, doctors and surgeons. Diagnosis and treatment. The circulatory system is central to most major diseases, heart attacks, stroke, hypertension, shock. A doctor cannot diagnose these conditions without understanding blood flow and pressure. Pharmacology. Medications need the bloodstream to reach their targets. Doctors must understand circulation to know how fast a drug will take effect, for example, IV versus oral, and how it will be distributed. Surgery. Surgeons must know the exact map of arteries and veins to avoid causing fatal bleeding during operations. 2. Nursing. Monitoring vital signs. Pulse and blood pressure are primary indicators of circulatory health. A nurse must understand what the numbers mean to detect early signs of deterioration. For example, a weak, thready pulse indicates shock. Medication administration. Nurses often administer IV fluids and drugs. They need to know circulation to choose the correct injection site and to watch for adverse reactions, like infiltration or circulatory overload. Patient positioning and mobility. Understanding circulation helps nurses know why they must turn bedridden patients to prevent bed sores, pressure ulcers caused by lack of blood flow to the skin. 3. Electromedics, biomedical equipment technicians. Device function. They maintain the machines that interact with the circulatory system. They need to know why a heart-lung machine must pump at a specific rate, or how a defibrillator uses electricity to reset the heart's rhythm. Troubleshooting. If a vital signs monitor shows an inaccurate reading, the technician must understand circulatory physiology to determine if the error is mechanical, machine failure, or physiological, patient issues, to fix the equipment correctly. 4. Medical informatics, health IT and data specialists. Data interpretation and coding. They design systems that store patient data. They need to understand terms like myocardial infarction or congestive heart failure to create accurate databases, billing codes, and electronic health records, EHRs. Clinical decision support. They build algorithms that alert doctors to problems. To program a warning for sepsis, they must understand that it involves a drop in blood pressure and increased heart rate, both circulatory functions. 5. Radiology, imaging professionals. Image acquisition. Many scans rely on the circulatory system. For example, CT scans often use contrast dye injected into the blood. The radiographer must time the scan perfectly to catch the dye as it moves through the specific artery or vein they need to visualize. Anatomical identification. X-rays and MRIs show the heart and major vessels. A radiographer must be able to distinguish a healthy aorta from an aneurysm, bulge, on an image to produce a useful diagnostic picture for the doctor. Regardless of your role, whether you're touching a patient, touching a machine, or touching data, you are interacting with the circulatory system. If you don't understand how blood flows, you cannot understand how disease spreads, how medicine works, or how the body fails.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.